I'll tell you a little bit about myself. Everyone should always know about you and your background. I'm from Schuylkill Haven, Pennsylvania. Don't hold it against me. It's by Pottsville. The only thing we got is England beer, and we got anthracite coal. That's about it. That's all you need. I went to Westchester University outside of Philadelphia. Went to Philadelphia College of Osteopathic Medicine, one of the oldest osteopathic schools. They traditionally taught manipulation and different types of theories prior to the advent of modern medicine, and we still get that as part of our core training. I did orthopedic surgery residency here in Cleveland. Wife's from Pittsburgh, so we tried to stay close. Pittsburgh girls do not leave Pittsburgh. Don't hold that against me either. I have been all over the UH system, mostly in the small community hospitals, Conneaut, Geauga, Richmond, Bedford, Geneva, also through, we do our trauma, we did in Florida, Fort Lauderdale, Cleveland Clinic for pediatrics. Mostly smaller community hospitals that I enjoyed. Did spine surgery fellowship in Rochester, New York, level 1 trauma center. You don't ever want to have a spine fracture, very devastating complications. We're not going to talk about those today. Pediatric orthopedic surgery, I liked kids a lot. It was fun. I liked deformity surgery, scoliosis, so I did a fellowship in peds at Cleveland Clinic. And then the question today and the topic of my lecture was how to maintain a healthy spine. So I'll tell you. There you go. Lecture's done. Don't smoke. Stay active. I swear to you, I see, give or take 20 people a day. 3/4 of them are for spine problems, the others for general orthopedic complaints, fracture care. 90+% smoke. Not exaggerating. 90+% come in with back pain. We'll explain why. So a couple things about this spine. I move around a lot, sorry if you're filming. The spine, it's designated into separate sections. We think of the spine as our neck, cervical spine, the chest, thoracic spine, has ribs attached, low back, down here, non-rib bearing vertebrae. There's typically 5. Some people are a little weird, they got 6, some people have 4, it all depends. It's how you're made. And then the sacrum and coccyx, not really part of this. It's sort of part of the spine, but not really. It's like our residual tail at the very bottom. Those segments are fused together. The discs don't really contribute, but there are nerves that come out of there that go to some important structures, bladder, and other organs. It's made up of a bony substance, the vertebral body, and there's important stuff that it shields. Think of insects, and they've got that real hard outer shell. Inside there's important stuff for them. Same thing with your spine. You've got your spinal cord in your cervical spine, your thoracic spine. It terminates or ends around the first lumbar vertebrae typically, and then you have a bunch of spinal nerves throughout there that go down to the legs, the bowel, the bladder. The disc has no blood supply. The disc is the shock absorber in between the 2 bones. It does not have blood supply in adults. In young children, very young, like infants, it still has blood supply, but it doesn't. This is where smoking comes in. Basically, what I tell patients is think of the nutritional support of your disc like a balloon. You blow up a balloon, you tie it off, put it down. How long does it take for the air to come out of that balloon? Months. That's how the nutrition support gets across the bone into the disc, is through what's called diffusion. Gas goes through. Nutrients go through. There's no blood. If you cut off the blood to your heart, you have a heart attack. You cut off the blood to your brain, you have a stroke. You die. Well, the disc, it's the same thing with smoking. You cut off the blood supply, or you decrease the gases from diffusing across. You're not going to get any nutrient. You're going to get disc. I hate using the term disc disease. It's not a disease. It's just the degeneration, aging process. But you get breakdown of the disc faster. You get bone spurs, arthritis of the back, muscles in the joints. So this is an example of a lumbar segment. There's lots of joints. It's just like a knee joint. You can get fluid on the knee, arthritis, you get increased fluid. You can get fluid in the back joints. You can get changes in pain with barometric pressure changes because of the seasonal changes. And some doctors will think you're crazy, but it's true, because there's gas, there's nitrogen gas in all of our joints. I love doing that, I'm sorry. Don't tell my mother, she gets very mad. But I've been doing it my whole life. I'm 35 and I have no arthritis in my hands yet. It doesn't cause arthritis, by the way. It does not cause arthritis. You get arthritis from other reasons. But what you're doing is you're releasing the nitrogen gas. So in these joints, when you have changes in barometric pressure, the nitrogen wants to go in or come out of the joint, which is why you get more pain from arthritis around the seasonal changes. So why do we get pain? Well, you improperly lift, you bend forward, we're staring down at our text, or our cell phones texting, we're looking up, painting ceilings, your job, there's many reasons. Posture's not very good, but it causes muscle pain typically, will cause some joint pain. You usually don't get nerve pain, which is the problem that is the most severe in terms of pain from just doing different activities. But sometimes you can.
What is it, that one before it?
I
What
don't
does
know
it
how to
say
do that.
underneath the pictures?
I'm sorry,
The screen before?
I can't go back, but tell me.
Okay. I was wondering what it said underneath the pictures. I couldn't read
Oh, I
it.
don't know. I took these pictures from, I'm just giving concepts. I took the pictures from Google Art. I should give them credit. Where I can give the website creators credit, I do on the bottom there. But it would take too long to put together. But yeah, I'm not sure what it said. Sorry. Now, as we get older, we lose bone density. Your peak bone density is at what age do you think? Like 50?
30.
30?
16.
Whoever said 30, 26, 24, women 26, guys, give or take, under 30. Downhill after that, it's all downhill, everything. I know, 35, had a disc herniation at 28. I mean, it's not fun, it's not fun. But I gotta maintain my bone density so I can prevent other problems. As you get older and your bone density decreases, you will start to walk around like this. You don't want that to happen. It's changing your spinal curve. And when you change your spinal curve, it's natural to do that to some extent over time. But as this curve in your mid-back gets more and more, you start to develop compression deformities, compression fractures, severe pain, and big problems. So you want to keep your bone density up. How do you do that? Don't smoke. Smoking decreases your bone density, causes arthritis, increases a lot of bad stuff from smoking. So try not to do it. I always tell patients I know it's hard to quit. Half my family smokes. I used to chew. I used to smoke occasionally. Finally gave it up about 5 years ago. Not for, I mean, my wife said stop or I'm going to smack you around a little bit. But it's, yeah, she's Greek. You don't mess with the Greek women. But it's important because the nicotine, you can vape, it still cuts off the blood supply. It decreases, it causes constriction of blood vessels, it decreases your nutritional flow. It just does. There's no easy way to say that. Now, as you get older, you start to develop arthritis. This is an arthritic spine on the right. The discs are gone at L4 and L5, the lowest two segments. There's arthritis in the back of the joints called the facet joints. Facet, it's pronounced facet, F-A-C-E-T. Facet joints. The hole where the nerve comes out. Medical talk, we got to talk fancy now. Instead of calling it a hole, we call it a foramen, because everything's based on Latin and Greek. So if you ever hear foraminal stenosis, stenosis is another complicated term. It's just clogging, decreasing space. So foraminal stenosis would be stenosis in the circle, in the hole where the nerve is coming out. This disc space decreases. As that goes down, as you get arthritis and bone spurs building up, the hole has to decrease. It doesn't, how can it stay the same size? It can't. So then you get foraminal stenosis. In the young patients, you can have a disc herniation. You can also get disc herniations when you're older. If you take 100 60-year-old patients or people and you put them through an MRI scanner, do you think a lot of people are going to have changes on their MRI or just a few? All.
Yeah.
You guys are right. Yes, you got it. Everyone has changes of degeneration. That's why I hate the term disease. It's not a disease. It's just part of the natural aging process, disc degenerative disease. It drives most spine people, practitioners and surgeons nuts because it's just part of the natural process of aging. But yes, all of them. And how many of those will have symptoms? Not that many. Really not that many. Especially not numbness, tingling, radiating pain going down the leg and down the arms. That would be nerve pain. Most people won't have those symptoms, but they'll have changes on MRI. And some surgeons will be confused or duped into operating when they really shouldn't be in the first place because you're not going to help the patient. So what can you do when you have symptoms?
Drugs.
Low back pain. Yeah, drugs, good stuff. Yeah. No, drugs aren't great, but it's a It's the best thing we, can offer easily. I think medications are overprescribed because we have to hustle, see patients, get them in, get them out. And you want to walk away with something, and we don't take the time to educate people, unfortunately. But yeah, sometimes it's easy to write a script, tell you to pick up some medicines. But there are some good effects from these anti-inflammatory drugs or medicines. NSAID, non-steroidal, meaning they're not a steroid, anti-inflammatory drug medication. Aleve, naproxen, ibuprofen, Motrin. There are those types of medicines. There's a bunch of prescription strength ones. They decrease inflammation, decrease pain. Tylenol or acetaminophen, just a pain reliever. These have an anti-inflammatory effect. They're good medicines. Some of them are very strong. Some of them you may have heard of, like Vioxx, which had big problems. Increases your risk of sudden death and stroke. That's not really good. So yeah, you can't be on that stuff all the time. You should really try to be careful with it, use it sparingly. Sometimes when you have nerve pain, the medicine of choice is gabapentin or Neurontin or pregabalin Lyrica. We don't know how it works, but yet it does work. It works in the brain. It works on the nerve in the brain we don't exactly understand it, but it's used in very high doses for those with seizure disorder, medium doses for those that have some mood issues or maybe some psychiatric diagnoses, low doses in diabetics or in patients with spine problems that have numbness tingling, like numbness tingling in your fingers or your toes. It's a good medicine, but again, it's medicine, and if you're trying to avoid that, take a more natural approach. It's obviously not the best option for some people. Cymbalta is an antidepressant, but it also treats chronic pain, so it has 2 indications that are approved for it. I don't prescribe that one. I leave that to family medicine and internist, primary care doctors, just because there's interactions with it, and I try not to go in there. I stick with the anti-inflammatories. I try to avoid steroids if we can, because they have other side effects on bones and joints that we try to avoid. And nerve medicines when needed and indicated, which you guys were just doing 15 minutes ago. That's like one of the greatest things for the back. Yoga is amazing. It really is. I don't take my own medicine. I don't do it until I have pain, and then I go 2 months, I'll do it, and then I don't do it again for 6 months till I have pain flare up again. But when you're driving and seated or sitting in positions for extended periods of time, you're going to get tight hip muscles, hip flexors, you're going to get tight low back muscles, you're going to get tight muscles everywhere. I mean, there's a reason that this has been around for 2,000 plus years. There's a reason. It's very good. Dry needling, acupuncture, traction, physical therapy, manipulation, chiropractic care. They're all options. All of them are options. But again, the 2 biggest, tell you, don't be overweight and don't smoke. Those 2 things, you're going to live a long, healthy life. Other options are blocks or injections. I don't perform them, but the pain management doctors here at ACMC, it's Dr. Hill, they perform all different types of injections, injecting numbing medicine, like a local anesthetic and a steroid to decrease the nerve pain, or trigger point injections, injecting anesthetic into the muscle, trying to trick the body. Similar concept to acupuncture and dry needling, except they're just adding some medicine to it. All kinds of different injections. So sometimes I'll have patients say, it didn't do anything for me. And it depends on what injection you had or what you were trying to treat. Not all of them work. Other options are surgery, last resort. I'm telling you, last resort. You can fuse the spine, which is not great long term, but some people need it because they don't have a lot of options and they have problems that dictate they need a fusion. Or you can decompress the spine. How do you do that? You take away the bone and some of the arthritis. You can't take it away all the way. You wouldn't have a spine left. There's so many joints that I told you about that make up the spine. You can't relieve the arthritis from every single one. You would literally be taking every joint out of the spine. You can't do it. That's where the fusion comes in, when you have to remove a lot or take away a lot of the joints to decompress the nerves. So that's just a brief overview of some things about the spine. But the main thing is don't smoke, stay physically fit, physically active, and if you can lose a couple pounds, lose them. Questions? I'll answer some vague, I'm not going to be diagnosing and treating you type of questions. I don't think the ACMC attorneys would like that. Sure.
How do we get arthritis? Have you figured out where it comes from?
So there's there's many different, my area of expertise, no, I don't know everything, but I know a little bit. Mainly it's genetic, and it's from things like smoking, previous injuries, It's called post-traumatic arthritis. But basically, if you injure the joint, doesn't matter how young you were, joints don't regenerate themselves. The cartilage lining has a you're born with it, and that's how the cartilage is going to be until you ding up your knee in your 30s or in your 20s. It doesn't regenerate.